Good morning, Deanna.
Morning, Earl. How are you?
Doing well. How are you? It's good to see you and nice to meet you. True, it's virtual. This is awesome. Will be Yanita's joining us today.
Yes, she said she's just putting the baby to sleep.
Okay. Ooh, we can wait a few minutes. That's all good. That's understandable, right?
I like your bookshelf.
Thank you. Appreciate. Oh, there's Yanita. What is that book behind you?
Well, this is a good one. The Lyme autism connection
Ooh.
about congenital Lyme and congenital Bartonella, and the research is really buried. But Dr. Bransfield, he's one of the main psychiatrists who treats Lyme. Hi, Anita.
Hi,
Hi.
Yanita. Thank you for joining us today,
Yeah.
and congratulations with the new baby.
Thank you.
Of course. Well, so glad you guys are here because we have a lot to digest and really share awareness regarding PANS and PANDAS. And for me, as an occupational therapist, have little, exposure to it, so to speak. So today we have Diana, founder of
Okay.
Healing on Earth, which is a nonprofit organization. And then we got Yanita, which is walking along families and an advocate for PANS. So I'm glad you guys made it today. And yeah, so like I said earlier, Deanna, we might just go off the script here because there is so much to talk about. So let's do a quick introduction and kind of like just walk through us, Deanna. Would you like to start us off?
Yeah. Name's Deanna Siskowski Lofries. I'm a licensed speech language pathologist by profession, and I'm a huge advocate for PANS PANDAS because my has it. Unbeknownst to me, I had Lyme and 7 co-infections, passed in utero to my oldest, and then snowballed into PANS. And it was very difficult to get a diagnosis and treatment. And I have worked with children who have a diagnosis of autism for many years, but truly some of them may have PANS, panda cerebral folate deficiency. They may be misdiagnosed. So there's a lot of information out there, but it is hard to find the truth. So I want to build awareness for that. Oh, you got muted.
Am I muted?
No,
Oh,
thank
you're
you
good.
for sharing that. That's powerful. I try to mute myself when someone's talking, just kind of like that, with the background music. But that's really powerful stuff. That journey. And Yanita, how did you guys kind of like two linked up? I was just curious about kind of like how this, now I'm kind of connected with Diana, basically. Now I'm
Yeah.
connected to you. It's just
Yeah.
the universe is so small now. Uh,
Yeah.
and yeah, so would you please share that?
Deanna was my son's speech therapist at school. So my son was referred to speech therapy, and Deanna was working with him. And I think she noticed a few things in Angelo that she recognized also in her daughter. So she kind of referred me to look into PANS and PANDAS for my son, and it turned out that yes, that was his diagnosis as well. Is that he also had PANS and PANDAS. Same thing, I believe, like the same markers of Lyme, and I believe I passed them down to him in utero as well. And yeah.
Wow, that's what a journey for sure. And Deanna, in terms of pants and just really your tell us about your nonprofit organization and kind of like how you support. And you mentioned earlier, you're a volunteer, taking a volunteer role, and putting many hats in different places here, so to speak. So would you be kind to share what's the Healing on Earth?
Yeah, so with Heal on Earth Child Inc., we want to build awareness, advocate. We have joined a group of 15 nonprofits across the globe to build awareness for PANS, PANDAS. We have 1 to 2 fundraisers per year. So we're a small area, right? Orange County, New York. We had 17 families apply for grants with the next grant round. Some have a diagnosis of autism, some they want to rule out PANS PANDAS or cerebral folate deficiency. So we fundraise and then provide medical grants. So it's a really important change. The biomedical community has made huge they've made so many changes, they've learned so much, but mainstream has not caught up.
Hmm. Wow. And yeah, let's dip let's deep into the biomedical. And for new listeners here, how would you describe PANS or PANDAS? And what's the acronym actually? It's kind of like stand for.
So PANS is the autoimmune encephalitis is the top of the umbrella term.
Hmm.
And then under that, PANS, which is pediatric autoimmune neuropsychiatric syndrome, it can be from mold, Lyme, Bartonella, Babesia, Strep, Staph, and then PANDAS is pediatric autoimmune neuropsychiatric syndrome induced from strep. So this is what the tricky part is. I was tested for Lyme. I was tested for co-infections multiple times by the CDC's test, and I was negative. So I figured, oh, I don't have Lyme. Okay.
Yeah.
I have chronic mono, I was told. Okay. Unbeknownst to me, I did have Lyme, and then it passed in utero. And like what happens with these relentless underlying pathogens, they can go through any barrier. The breast milk went through the placenta, um, the blood-brain barrier, and it induces a misdirected immune response. And then all this autoimmune comes in, right? And then these behaviors can, like OCD, fear, phobia, panic, anxiety, speech and language delays, because who
Mm.
can develop typically when they have all this neuroinflammation? No child can.
Wow. And Yanita, you mentioned about you get your son, received speech pathologist with Deanna. And can you take us back to moment when you realized when your child changes were just not just behavioral, developmental, but something more alarming, more into it?
Yeah, around when Angelo was like 1 years old, he seemed to be developing normally. He would say words, and we went to the pediatrician, everything seemed normal, and then there was just like a quick switch. It just seemed like he wasn't communicating to us anymore. Like we thought that he was communicating and he was speaking with us, but he wasn't fully like holding eye contact and having a true conversation. I mean, we thought maybe he had a little bit of delay. The pediatrician recommended that we go to speech and also occupational therapy.
Mm.
So we went to speech and occupational therapy, and the speech therapist during that time believed that his speech kind of was at a 11th month level when he was 13 months at the time. So we noticed that there was a difference also because I have a daughter who is just 13 months behind Angelo, and she was talking to us and she was holding conversations, and we noticed that he wasn't on the same level as her, even though she was 13 months behind. So I think it was more of like a dramatic shift in how he was interacting with us. Because when he was a child, he was like making eye contact, making noises, cooing. We didn't think anything was wrong. And then there was a hard shift to where he wasn't talking to us and he was kind of a little like distracted. It seemed like he wasn't really fully present with us. Like you could tell that there was something going on internally with him that was kind of distracting him from his normal development.
Wow. And how many children you have now? Just curious.
I just had my third, so
Wow.
I
Well,
have yeah.
congratulations. Wow. That's definitely a journey and really seeing the regression, so to speak. I think that's
Right.
kind of like the hallmark of autism in many ways. But
Mhm.
hence, we're touching a realm of inflammation and misdiagnosis, so to speak, or
Right.
and metabolic or autoimmune piece. So, Deanna, when we talked earlier, you mentioned the testing, biomedical, and kind of as a parent, first time listening to this, looking for answer. And, you know, can you walk us through this kind of like the process of in terms of the testing? Because when I listened to you earlier, there's some like foreign language to me that I'm not aware of. And I think just putting it out there and, kind of let the biomedical professional kind of like do the work for so to speak in terms of diagnosis and all that stuff.
Yeah, so I really had no idea that these doctors existed. A Lyme literate medical doctor, integrative doctor, naturopathic doctor. So there's naturopathic doctors who are Lyme literate, and they are aligned with specific testing like Vibrant Laboratories, Igenix Laboratories, Galaxy Labs, MDL Labs, and that's more specific blood work for tick-borne pathogens. So that's the first thing. You need a Lyme literate medical doctor. Um, we went to an immunologist in Connecticut, and he sat with us for 2 hours, and finally my life made sense. I said, "Oh, I don't really have chronic mono, I truly have Lyme." And then he said, "I'll do the blood work, but this is what I think you have. I think your daughter contracted it in utero," just based on her clinical symptoms. So
Oh. And how old was your child when this is kind of like happening and kind of like the whole process, let's say, okay, we found out this is the what's going on within, right? Because there's a lot of testing, blood work, and whatever medication they had. And kind of just can you walk us through to that process of okay, appointments, treatments, and other things that you probably did as well in terms of rehabilitative pieces to kind of like really holistic, integrative whole approach.
So I brought my daughter to the same pediatrician I went to, who's a nice man, but he's not informed when it came to integrative. And I kept expressing my concerns. They recommended speech therapy, OT, play therapy. It was working, but I was like, no, it's something else. You know, that gut feeling we
Mm,
talked about that parents have. She used to sweat a lot at night, which I did not know was a symptom of babesia. She was very developmentally delayed. She didn't walk till 20 months. Her left side was weak, and Lyme loves the left side.
hmm,
Kept searching for answers, but mainstream was not, they just weren't helping. So then at 2.5 years old, she had impetigo on her chin and she got a vaccine.
hmm.
And that is literally when all hell broke loose. Her behaviors were she was so aggressive, headbanging, attacking her sister. She was hospitalized in the neuro wing at Westchester Medical. And I said, I think she has this illness called PANS PANDAS. And I was told by the neurologist to get off the internet. And I'm like, okay, buddy. And then he put her on Lexapro, Abilify, Guanfacine, and Clonidine. That little, and I'm like, "No." So still, I didn't know. I didn't know the connection in our bodies. So and I did not get off the internet. I kept searching. And for grassroots movements and, like, moms, and there's dads too, but it is honestly typically the moms
Hmm.
who network, who help each other, like, through the Medical Academy of Pediatric and Special Needs. And then I found our doctor on YouTube. He was on the Today Show, Dr. Dennis Deboulis, and he diagnosed us correctly, finally. And then I just tried to learn as much as I possibly could, but it took a good 4 years to get her regulated.
Wow. And really, the prevalent rate, and that this is why I asked this, the prevalence rate for like autoimmune and metabolic diseases is just skyrocketing right now.
Mhm.
Out of proportion, guys, and it is wild to as an occupational therapist, you're totally right. And just that connection, like you said, with the gut, with the nervous system, if we're not addressing what's going on within, we're kind of like just touching the band-aids of, putting all this situation. So thank you for sharing that. And that's really challenging. And I can only imagine. And you need to, in terms of just as a parent out there,
Mhm.
looking for answer, can you kind of like walk us through kind of like your experience of finding kind of like help, support, and in just your own experience?
Yes. Honestly, Deanna was like an angel that showed up into my life of like knowing exactly like how to help my son because I always had concerns. I know like I expressed to my husband, I was like, maybe he has like a heavy metal like issue. Like I know like from like sort of like different vaccines. Like I do appreciate the science behind vaccines, but I don't appreciate the companies that fully make them because I think they pump them with so many extra things that are unnecessary. And so I was like, maybe there's something going on with that because like after a certain vaccine that he had, the shift was like immediate. And so I was doing research like the and I was on the internet like trying to figure out like is it like a mold thing? Is it a mold issue? Is it a heavy metal? And I was searching the internet and I was like looking things up, and then I got a phone call from my son's speech therapist, Deanna, and she kind of expressed what she noticed in Angelo and how she went to integrative doctor. And I was very interested because my background is I used to be a chiropractic assistant and I'm very familiar with like the body being able to heal itself and like working on like when your body is prime function, it's able to clear certain things out, clear infections out. But when you have an underlining issue, underlining inflammation, it makes it a little bit harder for your body to heal itself. And so I was wondering, like, what's going on with my son, especially at a young age? Like, their cells are so young and fresh and they rejuvenate very quickly. Children, like, they get a sickness and it's like, boom, they're over it very quickly. So I was like, what's going on with him? I knew that there was something happening internally that was causing his body not to function the way that it should. And so as I was searching on the internet and I got the phone call from Deanna, and like I really felt like my prayers were answered. I was like, this is it. Like, I know that this is gonna be helpful, and we went to, an integrative doctor in I think Newburgh in New York, and did a blood test on my son, and he found out that he had um, not an allergy, what is the word I'm looking for? I would say allergy right now to gluten and eggs. And at that time, like that was like what my son was eating a lot of. Like that's what kids can be picky eaters, and you're trying to figure out how am I going to feed this child. So I was giving him eggs every morning because I figured it was like a good source of protein, not realizing that his body was like having an autoimmune response, basically like inflammation. Like every time he ate it, it would cause an increase in the inflammation. And like I knew that there was something going on. So once we started cutting out the gluten and eggs, he kind of leveled off a little bit, but there was still something else. And like I was wondering like there could be more. And then I got connected to Dr. Summer, who she tested his blood, and also that's who discovered the PANS and PANDAS. And through her protocol is when we noticed a major shift with Angelo. She was kind of targeting the inflammation going on in his system, not just telling us what outside sources were causing the inflammation, but what targeting his cells so that they can rejuvenate for him to kind of be able to for his inflammation to decrease. And I will tell you, like, I've seen a huge difference in my son since I've been working with Dr. Summer and her like protocol for tackling PANS and PANDAS.
That
And he's still taking the medicine currently, and he's definitely making a shift, but there's still progress. Like I know Deanna said it took her daughter 4 years, and I'm patient to wait, but I'm definitely seeing a huge shift in my son's communication and his behavior, and it's truly amazing to see like my son kind of coming into himself, into his personality, and being able to communicate with us.
wow, that's powerful. Thank you for sharing that. And I know there's maybe parents like curious about, you know, maybe the protocol that he had. So I'd like to connect more about that in terms of like, information about Dr. Summer, right? So just kind of like share with the parents too. And I'll put that in the transcript once I posted this kind of like podcast theme. And yeah, so do you have any kind of like message to the parents that kind of like, looking something's more deeper in terms of, what's the first step I need to do? It's just as a parent itself.
Um, I don't know, just trust your instincts. I feel like when you know that you can tell that there's something going on, like don't let other people say, you just have to wait, like take your time and things will they'll grow out of it. But like when you have a feeling, you should definitely listen to it. And I don't know. I just kind of feel like it was a little serendipitous with me and Deanna. Like, I'm very grateful for being connected with her and having the ability to have found someone who has that background of PANS and PANDAS and was able to help me and my son. I just, I think that it's important to continue to be aware of what's going on with your child and just hopefully you can be connected with someone else who can help you with that or with this podcast. Like maybe this podcast is the connection that people are searching for, and I'm hoping that this is very helpful for anyone who's listening.
I mean, it's really helpful for me. I feel like the universe work in mysterious ways, like for, as I mentioned earlier with Deanna, and because my daughter just got diagnosed. We went to Boston Children Miracle Hospital last December. She got diagnosed with alopecia. Last October, I believe she just lost pretty much her 90% of her hair out of nowhere. And again, autoimmune, metabolic, and where to start to navigate this. And I really appreciate your, sharing all this information. And hence, Deanna, so here's what happened, all right? I'm just walking through this. This is off script. So I think August, we found like a dog tick on the back of her head, on back of her hair. I don't
Mm.
know, I'm not gonna be like a woo woo, this is what caused it. But we're talking about Lyme here, right? Can you kind of give us some insight just in general? What are like the symptoms or asymptomatic or kind of like, because you personally you went through it, right?
Yeah.
And then can you walk us through and because this is really deep in terms of how your autoimmune can really go, unfold.
That was my biggest takeaway, that these relentless underlying pathogens, whether it be COVID, Lyme, Bartonella, trigger the autoimmune, and it can be fibromyalgia, alopecia. So what I love about Dr. Summer Del Signor, she's a member of the MAPS community. She has a plan of action, the
Mhm.
specific testing, and again, the plan of action on all different levels, inflammation, neurotransmitter. She has access to some of the best doctors in the country, and they train other doctors. That's what the MAPS community really is, to train. So all children have access to this care because there's so many parents looking for care. They're looking for answers. And honestly, I can see why the parents shut down because they're dismissed. And honestly, I'll be perfectly honest, I was treated with a lot of disrespect, and I hear that from a lot of moms when they go to doctors, like, "Oh, this again," or, "Oh, you're overreacting," or so, yeah.
Yeah, in terms of like you mentioned about the encephalopathy, I'm not salvaging the word there. In terms of like how would that affect the body in terms of in general? I know it sounds like a really
Called autoimmune
yeah,
encephalitis. So when my daughter, Lynn, when hers got triggered, the changes were, it was unbelievable. She stopped eating. She would only eat goldfish, and she used to eat salmon like the day before. She started toe walking. Her pupils became very enlarged. She had started having these episodes of head banging. I mean, it was frightening. She was developmentally delayed before that. She had the symptom of congenital Lyme, of being very sluggish. Um, but this was like, there was no denying something happened to her. So that's really what like spurred my interest in learning more. And the more I found out the truth, I thought, how sad that it's like a hidden truth,
Mhm.
because because from the research I've done, big pharma rules, insurance companies rule, but who's paying the price? Our children.
wow. It really is. That's the sad reality right now, and it still is today. Insurance problem in terms of medications, testing, and the conflict between, mainstream medicine versus it's not even versus just like you can't even compare that because in terms of biomedical testing and as you mentioned earlier, like the mainstream testing for Lyme is different than biomedical testing, right?
Yeah.
Can you share a little bit about that in terms of because you mentioned about the one that I pick up right away is galaxy testing. I feel like I'm gonna go to the moon with that galaxy testing that you mentioned. And I was wondering if you can walk us about the different testing in terms of the Lyme.
Yeah, so there's private agencies that have more accurate testing for Lyme and co-infections, which is now under the umbrella term of tick-borne pathogens. So there's Igenix Labs, California, Galaxy Labs, MDL Labs, Vibrant Labs, and they're more sensitive to pick up on the Lyme, the Bartonella. Bartonella is a big one that's missed often, and it induces rage in children, really frightening rage, and it's difficult to treat, but it's treatable. But again, you need that thing. And the other part is it's all out of pocket.
Mhm.
Yeah.
So in terms of yeah, the out of pocket expense, and I know you kind of touched base a little bit of the 15 nonprofit organization that support and advocate for these children, right? Can you kind of like share kind of like your role into that, kind of like helping parents and in terms of the other organization that you're touch base with?
Wait, say the question one more time. Sorry.
So, as you mentioned, the out-of-pocket expense is wild, right? And your organization, or you touch base with organization that helps with kind of like supporting the out-of-pocket costs or whatever the parents need in general. So can you share some organization that right, I can put it on also in the transcript after this in general?
Yes, so we've joined forces with the Limelight Foundation. There's other PANS PANDAS foundations too. The Look Foundation's a really big one out of Massachusetts. That's who I'm modeling Heal on Earth Child Inc. So it'll be out of New York, but they do a beautiful job fundraising. Their fundraisers are huge. I think they fundraised $200,000. So that will go to grants for children because again, these doctors are worth every penny, but it's expensive. They've opened their own practices, right? They have rent, they have so much overhead, then the private testing is out of pocket. So that's where the grant money goes. So that's the main goal of Heal on Earth. And then to support research, because there's research, the Alex Manful Fund, big one, the Pandas Network, they're doing a lot of research. Again, the research is great. It's just taking so long to reach mainstream.
Yeah, especially with testing with the children in terms of medicine and medications, it's just so long to go. A lot of testing, a lot of different trials that they must go through, which is super, super challenging. And I'm really intrigued with the foundation in Massachusetts, and I would like to, you know, after this, message you on LinkedIn and touch base with that because I'm in Maine, and well, since my daughter with the autoimmune definitely needs some answers for that, and get some solution. Yeah, thank you for that, Deanna. This is powerful stuff, and there's so much to really discover about our health. Really discover.
Yes.
And I just
Now,
want to
Earl, for your daughter, I would possibly look into the directory on the Medical Academy of Pediatric and Special Needs. So they have a directory, and then it will show you on the bottom for autoimmune, for PANS, PANDAS, autism spectrum disorder, cerebral palsy, Down syndrome, and they can align you with a doctor
the map,
too.
right, that you share in LinkedIn. Now I'll put that in transcript too
Yes.
for other families here. I'm truly grateful with this podcast and yeah, and how's your son now? I know you see a big difference, but how's he doing?
He's communicating, like talking to us a lot more. Like before we like he's still delayed speech wise, but he's speaking like he kind of it's kind of funny because he'll like talk to us, but he'll talk to us like in whisper tones because like I don't know if he's like fully sure of what he's saying just yet. And like I know like when a child is typically developing, they like parrot what their parents say. And like he's kind of like still in the parroting phase. Like he's currently 5, but he's like still in the parroting phase. So like you can get him to say what you're saying, but like now he is kind of starting his own kind of conversations. Like he'll come up to me and he'll be like, "Hey, mommy," and like it's so heartwarming to hear because like he wouldn't say that before. Before he would kind of like his like Deanna was saying, like rage was kind of like his main form of communication. Like if he wanted to communicate, he would kind of like run up and hit you, or he would like run up and headbutt you, and like as a parent, you're just like, okay, like I know that he's trying to communicate, but like what is happening? What is fully going on with him? But now, like when he wants to get my attention, he'll say, "Hey, mommy," or he'll say, "Hey, da," which is what he calls his dad, or he'll say to his sister, he's like, "Hey, like come play," or like he's initiating his own speech, which is like so wonderful to see. And when it comes to his frustrations, he used to just like, kind of come up and hit all the time, like if we would take something away that he wanted. But now he's like able to kind of self-regulate in a way of like kind of calm his nervous system down on his own. But before, like his nervous system was just like on like 100, it felt like he was just like constantly trying to get it regulated, but he couldn't. Like he just physically and like mentally could not regulate. But like now we can see that he's able to kind of like, take a deal. He's still a 5-year-old, so like they have big emotions, but he's doing a lot better. He's doing more so what a 5-year-old would do when they are trying to regulate rather than just kind of like using like his hands and like hitting and things like that. And when he's overstimulated, you can tell he still has those emotions, but he's doing a lot better, and I'm very grateful for the help that Dr. Summer has given us.
Thank you so much. And Dr. Summer is based in New York, you said?
Yeah, she's in Beacon, New York.
Okay. Thank you for that information. I'll look her is that a guy or a girl? Or
A woman. Yeah,
oh,
it's a woman.
okay. I'll search her up too and put in the transcript and get more information about her. And Deanna, we're wrapping up here, and I want to thank you for you guys' time, Yanita. This has been amazing and really truly grateful. I'm confident this is not the first time I'd like to touch base with you guys and just like how's everyone doing. And I'm sure this is not going to be a one time thing because there's so many parents out there that wants answer. But I want to finish this with a kind of like
Yeah.
controversial piece. People like controversial. In terms of because I've been searching a lot of leucoborins, and this has been trending, right? And in terms of the efficiency of it or efficacy, in terms of in the nonverbal autism, which I did research on, there's some effectiveness in it. I don't know you guys' experience regarding leucovorin or Deanna. Would you like to share something before we finish our podcast here?
Being recorded.
All right, we are back. I want to end the podcast with some controversial stuff, right? If you're into it. So in terms of that, leucovorin, it's been trending. I've studied it, the effectiveness of it, researched it, and it looks like it's really effective for nonverbal autism. And I don't know, can you share about a little bit your experience in regards to navigating that area in terms of that medicine?
So in our biomedical community, so I get to attend the workshops for Medical Academy of Pediatric and Special Needs. And yes, there's a subgroup of children who benefit from leucovorin. So years ago, some of these children in their 20s now who've received treatment, they had to get a spinal tap to test. And now they have the FRAT test, folate receptor antibody test. We've seen it from $300 to $500. But again, it's those specialists, those integrative doctors who are aligned with this test. Or people can ask, sometimes if they get lucky, their doctor can order the test, the FRAT test. Then the children go on leucovorin. The best is from a compounded pharmacy because it cannot have any dairy in it. So some of these companies are giving leucovorin to children that has dairy. It can't because the dairy binds to those receptors and blocks them. So it's interesting, and this information has actually, from what I've learned from the biomedical community, been out there for at least 10 years. But the FRAT test is helping a subgroup of children who have the folate receptor antibodies that are blocked.
Yeah, so that's the folinic piece, right? Like that needs for the brain to process because it's lack of folate or it's not like a folate, right? Can you explain that a little bit?
So the folate helps with development. And also the child I know, Vince Rinsella, well, he's not a child, he's a young adult now. He's very famous in the spellers world. He was having seizures, nonstop seizures. So mom rushed him to Philly Children's Hospital, CHOP, and got the spinal tap. This is years ago. And he needed the leucovorin. So it helps with seizures, brain development. But that, again, goes back to that differential diagnosis. How much of what we're calling autism is something else?
Yo, you hit the nail on the cross or something like that. Wow. It really is. It's autoimmune. It's the brain is inflamed, the gut is inflamed.
Yeah.
And yeah, well, FRAT test. I'm not familiar with FRAT test. Can you walk us a little bit about FRAT test? What is it about? What's
The only thing I know is when I attend the MAPS conferences, there's vendors there.
Okay.
They have their specific testing. So the FRAT test was created to identify if, here, let me look. because I'm not that familiar because my daughter didn't have it, but I'm learning from the other parents.
Yeah.
The FRAT test is a folate receptor autoantibody test. So it's a blood test that checks for autoantibodies, which are blocking the body's folate receptors, especially those transporting folate to the brain, which, like you said, right, it's vital for neurological development. And we need to make this differential diagnosis in developmental delays, autism, seizure disorders. So really identifying the cerebral folate deficiency. It's so simple, right?
Yeah.
But it's just not mainstream yet. It's becoming more.
We look at and this is hard for any parents out there. I mean, it's scary to be a parent now.
Yes, it is.
It's so much, and it really is overwhelming in many ways. And for me, just journeying of that piece of, understanding the autoimmune, we had, appointments with oncology, hematology, endocrinologists, and trying to, they look at these numbers and it's not matching. And then if we look at more in the biomedical perspective, way much more, right? And this is powerful stuff. And I'm sure this is not the last conversation we're gonna have, Deanna, because I'm gonna keep picking up what's going on and what's the world. So, what's your next kind of like conference you're gonna attend? I'm curious in terms of kind of like this journey or any workshops in general.
The next, I'm being trained by Project Lyme. Isabel Rose is her name. She is a mother who started Mothers Against Lyme. Her children have congenital Lyme, also Lyme-induced autism. And I'll be a facilitator for other parents. I really want to learn how there's ways to treat a pregnant mother. If a pregnant mother has HIV, right? You can reduce the risk of transmission to the baby. That is what I have because my daughter suffered profoundly. I met so many children. They really, truly suffer when they have congenital infection because the effects are so far reaching of these infections. So how to reduce the risk of transmission. There's a cocktail that mothers go on when they're pregnant if they have Lyme. Some don't know they have it. Reduces the risk of transmission because I don't want my grandchildren to have this. I don't want other people to suffer. We really need to make change because there are so many people, they have no idea they even have it. The other is how is COVID affecting pregnant mothers? Because it can transmit through. And then what is the course of action? Like we love Dr. Summerdell Signor because she has a plan of action to heal the whole body as an integrative whole. She has that training. So that's it, to build awareness, to get more training, to connect with more mothers. And I'm sure you hear a lot of parents come to you with their concerns, and we're all connected, like you said, through the universe.
Yeah, we really do.
For sure.
Vibrational being, and the field, the realm that we're into. I didn't expect the podcast going to be more like this. It's more personal to me. It's more, with my daughter's going through, your daughter, and I feel like I want to end this, but I have another question. How's your time? How are we doing on time?
Oh, I'm fine. We're fine.
Okay. And pregnancy, and I think this is the last one. Pregnancy, it's such a crucial for everybody. We were, in the womb one time. And actually I had one time, because I was a C-section baby, and I had a rebirth of one of the reflex work. that that was something. Like I never had the experience of the somatic work of emotional release in my body.
That was interesting. You were teaching me with the primal reflexes because OTs who are really integrative, the work they do is it's amazing.
Yeah.
It's amazing. They can see where something happened developmentally to the child. The OTs I work with, because I'm on a lot of awesome teams.
Yeah.
I'm like, wow.
Yeah. And I had to experience the reflex itself. That was the TLR, because when we're in the birth process, we're kind of like that, kind of like child pose, going to the birth canal, and I got stuck. And then metaphorically, my body just always trying to stretch, kind of like trying to find my above my head level, and just in general, kind of like growing up, just noticing it more. Then when I was in that TLR, things just showed up, and this is wild. My daughter was also C-section, and this is an at birth trauma. It's not really talked about at all in terms of
Yeah.
birth trauma itself, C-section, forced delivery, whatever. So I had this feeling that I was like a surrogate to my daughter. I felt my daughter within me got stuck in the utero too during the somatic workshop, which is
Yeah,
the
the
connection.
connection.
Yeah, the wildest of the wild. So it's very subjective, but that's what I felt, and I mean, I was a really emotional mess after that, but it was good because there's some support there that
Yeah.
was able to help me get back on track because that was deep.
You reach out to help others because we're all connected. And I really connect with moms. They need help with advocacy because they're exhausted.
Hmm.
They may not have the financial means. They're reaching out for help. And honestly, we're going to mainstream medicine. We're kind of getting shot down like, oh, just accept it. Oh, no, no, nothing we can do. There's a lot we can do. There's a lot.
Yeah,
There's a lot.
based on your experience, this is the last one. I keep saying this too. This is the last one. Based on your experience, what was your kind of like your message for like, people that trying to get pregnant or like, in the pregnancy right now? Like kind of like your experience in terms of what potentially we're passing, not to scare people, but just to be aware, right? What would be your message to that?
In retrospect, I would have gone to an integrative doctor who specializes in Lyme, who specializes in like homeostasis of the body. I would have done acupuncture throughout my pregnancy,
Hmm.
um, just to really find out the truth because I also have the specialized testing. I had heavy metals, stored high heavy metals of lead and mercury. So I took a chelating agent, then you urinate, and your urine is sent to doctor's data. It's a more accurate testing for heavy metals. My daughters had the same high lead and high mercury. It came from me. So the total load is starting in utero. Yeah, and there's ways to heal. We got IV chelation, there's homeopathy, there's many different approaches to take, but something has to be done because otherwise our bodies are going haywire. The total load, again, is just too heavy. So that's what I would have done beforehand. Like, I'm 40 years old now. There's other issues that if I ever have another child, probably would be healthier than my first two because my total load was too heavy, untreated Lyme. I had mold in my body. It all passes.
Wow.
Placenta is penetrable. I really thought, oh, the placenta will protect,
Yeah.
No.
And yeah, I mean, we were talking about how the reflex early on, the fear paralysis reflex, which is our core withdrawal, feeling the safe in the utero and the external world within 21 days after conception, and then the moral reflex, size of a bee, 9 weeks. We have that
Wow.
starting lens. Ah, so
Interesting.
imagine being shocked and placenta was like, what is that? You know,
Yes.
so your nervous system development in general have that startle kids that I work with where they're just like very, very hyper reactive. And really what we work on is a lot of, the touch base work that we do in terms of the integrative stuff because skin is the first that emerge in the utero.
So interesting because my daughter who went through all the health difficulties, she still had it even
Yeah.
at 18 months still.
Yeah.
And then when my second was born, did not have that.
Yeah. And when you notice it, that's kind of like the hyper reactive response. So definitely, we work with a lot of touch base. We incorporate some cranial work, craniosacral work, um, and a lot of primitive reflex work. And this is the work, and I'm not this is the workshop like Dr. Maskotova. I don't know if you heard her, Dr. Carla Hannaford. She's kind of like more like a brain gym instructor. Uh,
Yes.
but she kind of like use touch for health also with different acupressure points in the body And Moira Dempsey, she's like a co-founder of the rhythmic movement. I don't know. That's a rhythmic movement is really powerful, integrated. Because imagine this, like as I mentioned about the vibrational being. Every time when you walk, move around when you're pregnant, there's that vibrational feeling in the placenta, and then the rhythmic movement reintroduce that to the nervous system, and the nervous system recognize it, that vibrational feeling of the rhythm from the
Makes sense.
yeah, even though they're grown up now. So that we've seen that home program really focus on the rhythmic movement. So that's something that that might be still beneficial for your child. At all age, I use it for myself. Really,
Can you put all of this information
I'll
in
just
the
like this. Yes.
because I've heard of chiropractors taking this approach.
Yeah.
Acupuncture, my daughter won't do, but she did some energy medicine called Ondemed. It works on the frequencies in the body. That was interesting from
Yeah.
Germany.
Yeah.
And when the healing frequencies, how much her body changed. That's how I know. I said she can heal. I'm learning every day.
Yeah.
I'm learning new today, every day to learn more, because every child deserves access to heal. It's a
Yeah.
human right. It's supposed to be a
So,
human right.
yeah, I'll put that all information. And then in February, middle of February, I have some time to do like a primitive reflex, just kind of like in general. I'll send you the info in the LinkedIn, maybe some of your parents' connection. Just just touch base. It's free. Just kind of like this. I'm just talking like a presentation. And then basically kind of just invite people, parents. I presented it at the Autism Society, and they just jaw drop. It's just like,
Yeah, there's such an interest in the
yeah,
sensory. Such
yeah.
I've, I have a lot of educators, a lot of followers who are educators on LinkedIn, so that would be great.
Yeah, so I'll message you again. Maybe we can reconnect, and then I'll work on editing all this stuff. And this has been really exciting. I'm truly grateful, and again, it hits hard home because I'm in kind of like the early stage of understanding alopecia, autoimmune, potentially Lyme. Because when we saw that dog
Yeah.
tick, and then everything kind of just kind of like fall apart, and we tested Lyme. It's not Lyme. The doctor said it's not Lyme, but maybe we took the wrong test. So
Which test did they do? The Western Lyme blot, CDC?
yeah, something related to that. I'm sure. Yeah, I'm sure it's the protocol, whatever it is. But they said negative. But it was a dog tick too. It's not like a deer tick. And Maine, the influx of increase of Lyme disease in Maine. I mean, everywhere now too.
Yes.
No one talks about it. No one talks about this. But the increase of tick-borne diseases in general.
Yeah.
Maybe it's not even Lyme, right? It could be just tick-borne diseases because it's everywhere.
And
It
they're no joke. The effects are it's unbelievable. Any changes in your daughter's behavior, or it's just the autoimmune?
fear, lots of fear-based
Yeah,
reaction. Fear-based
that
reaction here. She
sounds
started way too easy now. Sleep is off in terms of sleeping. She would wake up in the middle of the night, and
like,
yeah, that.
you'll get to the bot. She's blessed to have you as a parent.
Oh, thank you. I appreciate that. It's a journey, right? So we're in this journey, and thank you for blessing us with your presence, Ian. I can't thank you enough. And I'm
Thank
sure this is
you.
not the first time we're gonna, either virtual, maybe one day or one of this workshop we can cross path one day. And that's why I asked you, what's your next journey here? So I'm so
Well,
thankful.
I'm very excited for the next grant recipient to see
Yeah,
what shows up on his blood work. He'll be going to Dr. Summer also, and then we'll share if you'd like to do another podcast
I
because
love
he presents differently from the first grant recipient, but there's a lot of parents searching for answers for children like him. His name's Bob. Um,
We'll,
so,
we'll we'll connect on LinkedIn. I appreciate it. Thank you so much.
well, thank you. Have a beautiful day.
Thank you.